4.5% of the members got to a representative within a minute. That still did not meet the service level. We did run into some challenges, and we experienced, with the outbreak of the COVID, and we use a lot of our, we call them Weeby vendors. We have an ecosystem of third parties we contract with to support. They had some challenges this year. That's our problem, or North Chappelle's. That's not their problem. It's our collective problem. We're responsible for the service, but we did have some challenges in that area. And that resulted in less than desirable performance. And while they're not meeting the expectations, we do have plans to improve them. And some of the things we did during enrollment to mitigate this is we extended hours. We did put in Saturday hours. So if people were getting delays, because we have that known backlog, we did put those in place, those extended hours, to attempt to improve the member experience. And as part of our agreement, we did add 12 staff, as I said, during annual enrollment. They clearly weren't as efficient as we'd like, but one of the things we're working on is for the next enrollment period is to build additional redundancies in, related to making sure that there's additional staff trained, cross-trained, and that we've essentially removed that vendor out of our ecosystem where we had challenges, replacing them and getting them up to speed. That's all I had on that one, Paul. Unless there's any questions that may elicit some questions this slide.
I have a quick question.
Sure.
On that last slide, you said that 90% are answered within 1 minute, but the average.
I'm sorry, Marlene. That's our target is 90%, and we achieved 84.5. So it was low.
Okay, 82 within 1 minute, but the average was 9 minutes. So does that mean there were people waiting for long periods, half an hour to an hour or so?
You could have had wait times upwards of 20 to 25 minutes during that period. Yes.
Okay, thank you.
And that's Marlene, typically when we see that, just so you know, is it's that end of enrollment. So we have that last day or two where everything builds up. So one of the things we're going to try to do is where we know we now that we have some data sets where we can see is, people typically either enroll online or via phone, unless they have a problem, like there's something unique that happened to them that they want to talk to somebody. But we can start to mine the data to see who's calling when year over year, because we have that data. And then what we can start to do is we can start to target, if we know that Kevin Canoon, I'm just going to use me, Kevin Canoon as an example, always likes to wait for the last 2 enrollments to the last day. We might try to do some more targeted communication or even some outreach, because there's periods where we don't have heavy call volume. So if there's things we can do with simply calling out to them, to these various populations saying, hey, we see you didn't enroll. If you want to enroll, here's how you do it. We can help you now, or another thing. We want to try to really get creative, so we're not creating that backlog of the last few days. It's just not a desirable experience. We know that.
You know if they're calling in after they've had trouble on the internet, or do you keep that? Or are they just calling first because they prefer to call? And
it wasn't trouble with the internet. The biggest thing we heard, and one of our highest call volumes, was the password reset process. So we have some additional we made some changes during enrollment, but we have some additional changes we're going to recommend, and we're actually going to roll it out before annual enrollment, so we can get some data to see if that's going to improve, or if we need to do something a little bit different for the city. Thank you.
Kevin, this is Matt. I just, on that slide again, I did want to ask, with the 11%, can you go back, Paul? Thanks. The 11% calls abandoned, do you have a sense of, are those abandoned calls happening at the end of open enrollment during that crunch where you have a lot of calls?
Yeah, that's when we saw it the most, is when the peak volume that last week is when the call volume was the heaviest. There was some in the beginning, because you get a little bit of a spike in the beginning when the communications go up, but it was more at the end. And Matt, just to be fully transparent with the board and to you, because you asked the questions, this also was exacerbated by, we had some staffing challenges that I mentioned with our provider, and we couldn't get people trained up fast enough, right? Because they have to go through a training program. So it resulted in longer handle times, those things. It was exacerbated. So there's some additional redundancy we have to build in there.
Yeah, and I would imagine for next time, I mean, especially when we saw the drop in calls year over year, you would hope that, we would have adequate staff on hand. So for next time around, knowing, hopefully we'll address the issue that we get a lot of volume right at the end, but knowing that we may just see that pattern continue, just to have adequate staffing during that crunch at the end, just given the behavior.
Yep, understood.
This is Tony Royce. This is a similar challenge you had with other customers.
I won't say across the board. You have some very specific staffing agreements in the contract. I think it's 6 and 12 is what we're required to do, and we staff up actually more than that because of our experience. But generally, I would say there were pockets of it, to be honest with you, and maybe I'll defer to David Basson because he sees all the clients. But I won't say it was fully systematic. I will tell you again where we had some of our what I call smaller subcontractors. They were more challenged because we flipped over from a fully in-office workforce to a fully remote workforce in really about less than a week. Morneau Chappelle did, and we did it relatively without any impact. We actually started to see service, at least from my perspective, and I'll let David jump in a second, is decrease really as the pandemic continued, to be honest, and people were just we saw more drops. That's what it was. But I won't say it was wholesalely across the board, to answer your question, Tony. David?
Yeah, and I'll be happy to answer that, Kevin, and good morning, everyone. And Tony, I think it's a very good question. I mean, without going into too much detail at a high level, I think the answer is, as Kevin pointed out, it was somewhat vendor dependent. So we definitely did have a bit of the challenges that Kevin just pointed out in terms of our population, in terms of just the wear and tear around COVID. But where we had a specific vendor who could not recruit to the level that we wanted, and we had higher attrition rates, that posed a challenge because we can't put untrained folks on the phone. It's actually not that hard to get bodies, but we need people trained to address service properly. And that's where we ran into the challenge here. So I would say definitely we had pockets where that vendor was used, where our other customers, Tony, saw those challenges. And as Kevin said, that's why we've made a change with that vendor to use our vendors that won't have those problems in the future.
This is Wendy. I think, every year we talk about trying to encourage people to do open enrollment, earlier on in the process. And we've done everything, raffles and things like that to try to get it done. But we know that human nature is such that people are going to wait till the last minute, just as you do for, doing your taxes or any of these other things. So I think we really depend on you as the vendor to recognize a human nature and to prepare accordingly.
It's fair, Wendy. Agreed.
You want to move ahead, Kevin, and
Yep.
I have some additional questions at the end, but people can jump in when they're ready.
Yeah, absolutely. So this was just this slide, very busy, but it represents our year-over-year satisfaction results from the customer service center. So our performance target is 90%. We're running slightly above 90% on all the all the key categories, and this compromises very satisfied or satisfied. So that's good news. This aligns with our overall client base. We want people to be satisfied. What we did notice, and we wanted to call out, is that there was an increase of a little over about 1.25% on the very dissatisfied members that had contacted us. So again, while we're meeting the metrics, those are the easy things. You want to focus on the outliers. So we spent a bit of time looking at these. And we actually did some callbacks to people to find out, was it something we did as a customer service perspective? Was it something related to the plan that we can't control? Was it something else within the ecosystem of the benefits program? So we're starting. We actually have some initial data, and in fairness, Paul and the rest of the city team haven't seen it yet, but we're finding is there's kind of 3 areas that we're seeing. One is it's coming down to we just didn't provide good customer service, to be honest with you. The answer was, maybe not provided accurately or with the level of detail. So that's learning and training. We found out that some of them were related to the services we provide with the city benefits team, related to various processes that we'll have to look at. And then some where they just didn't like our answer. And then we did have a couple, or at least one case I remember, where they said, actually, my question got answered. It actually was resolved. And afterwards they were satisfied. Again, what we're trying to say here is that we recognize that, while overall we're meeting it, we want to look at the areas where dissatisfaction, where there's anomalies in data that showed an increase, and how are we responding on that. So we'll continue to do that and work with the city, not just for annual enrollment, but for ongoing, because we do the survey after each of our calls. I think that's all I had. And then maybe the last point, it's in the bottom right corner, and this will help us transition to some of the communication and things we talked about that occurred during annual enrollment, is making sure that we continue to look at how we either update the various components of the website or any of the communication changes that the city needs, and balancing out with not creating too many communications that are complex, but also providing the right information to the member. So we'll cover that in a minute. David, I don't know if you had a question at that point. I'm sorry.
Well, my question is, and it may hold till, I tell you what, I'll hold till the end till you finish your presentation.
Okay, great. I just want to make sure I didn't glean over. Okay, so the next slide, and again, I don't think we need to read this. It was in the last report out. It categorized the buckets of feedback that the city team, some of the Siegel observations working with Stephen and his team, and Morneau Chappelle had identified it as some areas of opportunity. So what we did is we put a lot of detail together. I won't go through all the detail. I'll focus on, if you all have read it, on any questions you have. But the next slide really starts to illustrate how we categorize the buckets. So there were 4 main areas of opportunities. There were communication, online enrollment, call center, and technology. We bucketed each of the pieces of feedback and discussions we had, and then we put them into classifications. And what these mean are, is a service improvement is something we just need to do better, whether it's contractually related or just generally service related. It's probably the highest priority and the quickest item we can action on. And then there's the component of service enhancements. This is where we want to update requirements. There's been changes to either a system and or process and how we do something to create a better experience. And then the last one is product related. It's really core to the system. Can we make changes core to our system, the underlying system, not the city configuration? And I'm sorry if I'm being too technical, but there's a base system underneath that. If city has certain things they want to do, we may have to change that to make sure it effectively works for your specific coding. So we categorize those into buckets, and service improvement had 4 items, enhancements had 3, and then there were approximately 5 product changes. And in the next few slides, again, I won't go in through all the detail, but it's to really answer each of the items that came up. And I think I can pick one out here. I think the first one's a great example. Is that the city stated that the current email functionality doesn't meet its needs. So we categorize this as a service improvement. How can we get better? So we were going through requirements review this month, and then we're going to work to correct and deploy any of those changes to communications that the city desires. And there will be some debate back and forth, because if they get too customized or too unique, it may require the underlying system change. But generally, we think we can accomplish this and have this done by May. So what we did on each of these is we attempted in a very concise format, because there's a lot more behind this, is what is the proposed solution and the steps, and then the delivery date of each of them, and categorize them as were they an improvement, an enhancement, or a product change.
So Kevin, let me ask the question here, and it may be more directed toward Paul. I'm sorry. In regards to what we asked in the December meeting, these 7 buckets, or at least there were 7 key points that we had tried to address as needs improvement. So I'm directing, I guess, to Stephen. Do we think, and I'm reading your report, are they in line with what we requested of them, Stephen, or are we making progress, or is it still not up to standard? And I heard Kevin say a couple times you guys just didn't do a good job of it. So I don't know if the issue was we weren't clear on communication or whatever the fix is. I'm asking Murphy, is this satisfactory? Is this response satisfactory, or is there still more to be done?
David, thanks for calling me out. When you say Stephen, I think Steve Montana, so
Yeah,
my apologies.
yeah.
I think this is a work in progress. I think the idea of identifying where there are gaps, and I think this report details that fairly well. And I think working more closely and more focused on these topics as we move through the rest of the year, as well as into open enrollment for 2022. Our objective is to have a better outcome over the course of that process compared to this one. And we'll use the interim time between now and then to monitor and update the committee on changes and improvements.
And so in your opinion, where they are right now, this is improvement, or we're moving in as fast as we need to, or?
It's first steps. I think to me, I think the identification is important, but I think we want to use the interim time. First quarter is ending here in a couple days. So we'll be able to monitor progress on performance goals relative to the first quarter, and that'll help give us a good benchmark if we're closing gaps per Kevin's observations.
And so Kevin, and my last question, I'll turn it back over to the rest of the group, is that as Wendy said, I would hope that you all would have trying to be preemptive in some of these things, anticipating these things happening. I want to be clear and I didn't know what your answer was on this. Were we not clear, or was some of the things that you weren't able to accomplish outside of the scope of what you agreed to do? Or I'm not clear on what the problem exactly was, other than you said you didn't have staff.
So in our assessment, I would say and I would maybe go back, Paul, I think this is probably the best categorization of summarizing it. I think there were, I think you said, David, 8 items. We actually viewed it as more like 12 when we broke them down into detailed buckets. I would say there were 4 that we should just not have missed on. Some of them, I'll call them blocking and tackling. I think the service enhancements and the product changes, which represents about 2/3 of it, I think those we have to work in collaboration with the city to tweak the requirements that we put in place, enhance them or tweak them is what I call. So I don't want to say they're failures. I would more categorize them as these are improvements that we need to work on. And, some of them are real simple, right? It's, and some of them are actually in flight or done. But I think that's how I would categorize them. I hope that answers your question. I think some of them are things the city wants, and I would say that's about 8 of them. And I would say 4 of them are that just our core expectations that we need to improve on, and quickly.
Thank you. I had no other questions, Stephen or Kevin. I'll get back to you.
Thank you.
Okay. I think I'm managing to the time pretty well here. So this is another area, and I think Stephen Murphy mentioned it in his opening comments. We have performance guarantees that are in place. There was a question at the last meeting. This is a summary of the quarter-over-quarter performance reviews, and how we're performing against them, which is under our expectations. There's really, I would say, 2 or 3 causes, and what we're seeing is one is that in some cases we're just purely slowing down to try to get it right out the door timely. Accurately. So some of it's slow down to make sure that, when something's produced out of the system, we have a process that we go through with the city, just making sure it's right. So some of them are self-inflicted, I'll call, but it's the right thing to do. Second is we've talked about a number of the call center metrics and responsiveness and timeliness that we're addressing, which I'll talk about where we're at right now. But really what it comes down to is if you look at this chart, of the 29 there's 31 metrics. 2 are in city review right now. They have a process they go through in which they evaluate certain things that they'll be completing. But of the 29 measured stats, we had 9 approximately on average where we missed 9 to 10. We obviously have performance penalties. The good news that we can report is that as of February, 25 of the 29 are now fully back on track with our goal of getting, for all 29 that we're responsible for measuring outside of the city too, that we'll be back on track between early April and end of May. So that's just a high level summary of the metrics. So we again want to acknowledge that we're not where we need to be. And then on each of the subsequent slides, because I think this is important, it talks specifically about each action we're taking on each of the metrics, when it's going to be completed, and what we're, kind of the various steps. So we talked about call handling time. We have approximately actually three of them are not completed from the timing of this report. That's just one example of where we've already taken very specific action. And it's not just meeting the metrics, it's about, looking a little bit further and deeper, as we talked about, looking at the survey results and seeing, are there things we can do systematically or through our delivery with our call center reps to improve member experience. So it's not just about meeting the statistics, it's about trying to dig a little bit deeper. And we've made some changes. I didn't mention this, but it's probably important to know is we've replaced a very significant leadership role, which is one of the reasons why David is here, in case you have any questions about it, is in our call center leadership. That seemed to be an area where we were experiencing a lot of pain, and he has made some substantial changes. So we're already starting to see the fruits of that change happening at the very beginning of this year. So not an excuse. I just want you to have transparency to what's happening. We're accountable for these results. So I want to pause there. So there may be some questions.
Donna, did you have a question?
Thank you, David. Yes. Hi, this is Shauna. I had a question about the call center survey. How many, I'm curious as to what the process is and how many people actually complete that survey. I'm assuming that the people who dropped don't end up completing it unless there's some separate kind of process for that. But, presumably those 11%, I think, was it, or whatever, wouldn't have been satisfied. So I'm curious how that process goes, if you could address that. Thanks.
Yeah, and I don't have, because I'm in present mode here on my screen. Tanya, I don't know if you have the actual number of surveys that were taken. I believe it was in the right around, it's 1,400 sounds like the right number. Do you have that handy?
October 2019, it was 1,541. In October 2020, it was 1,146.
So if you look at the call volumes, that was on, I think, a little over 9,000 calls and a little over 7,000 calls. The percentage. So you can do the math, but that's a pretty good hit rate for a survey. People are giving us their feedback.
But Kevin, just to make sure we fully answer Shauna's question. Shauna, you are correct that if someone hangs up before they have an opportunity to take the survey, then they don't take the survey. So they would have to stay on the line and take the survey. Kevin, I believe that's how we have it set up for the city.
That is correct. Yes. It's an optional survey. You're not forced through it. You can disconnect at any time.
And Shauna, just to help fully answer the question, across our book, I think the answer is it depends. I think it's fair to say that some people, if they wait too long, they may not be satisfied. Other folks just don't want to wait at all. So we have people hanging up after 10 seconds, after 20 seconds, after 30 seconds, and they may not be dissatisfied. They just may have very limited amount of time, and they didn't want to wait the minute or 2 minutes that they may have been on hold. So we see abandonment even when we're answering calls within SLA. So I wouldn't necessarily say all of the 11% abandonment are dissatisfied. I think it's fair to say that some of them would be, but that would be true across our entire book.
Okay, thank you.
Any other questions from the committee?
David, this is Wendy. Can I ask a question?
Sure. Go ahead.
So, appreciate Morno being here and, on YouTube Live and everything to talk about this. And, obviously you're on a performance improvement plan, which is not good, but we appreciate that you're being transparent in the steps that you're taking to try to fix it. So I have two questions. One is a very specific and one's more of a general one. The specific one is, my recollection is that there were also some problems with getting materials out to the people who had asked, to be paperless. And I was wondering if all those things, because obviously we want to move towards sustainability, if all of those issues had been, they're not related to call center per se, if those issues had been rectified. So I'll let you do that one first, then I'll ask you the more general one.
Tanya, do you want?
Yes, I can answer this one. So right now, Wendy, I'm working with Paul. We're looking at the requirements around the email notification process. What we've determined is there's some paper updates that need to be completed first before we can turn on the online communication process. So there's a number of changes that the city is making to the paper communications that's being sent out. And once those paper communications are updated fully, we will then look again at the electronic communication process. And we're working on enhancements to that process as well. So I think, Paul, if you want to chime in on anything additional, it looks like this one is maybe one that rolls out into 2022.
So the only thing I'll add on that is on the screen that's being shared right now, we're looking at email as being a comprehensive aspect. So we identified that it's not just sending the email out, it's also making sure that experience of that email person matches what print is. And so I think that's kind of where Tanya's pointing to in that middle section there on the screen, is where that difficulty is kind of postponing things, is making sure that print communication experience and email experience are pretty as equal as they can be.
Okay, and then on my broader, more significant issue is, the city is moving to a new, HRP system, Workday, in, 8 months. And there's just going to be a lot of effort that's going to take place between now and then also going live, where we need to make sure that, people's pay is right. And so we can't really have benefits problems on top of that. And I suspect that my staff are going to be spending a lot of time working to make sure, the transition is done appropriately. And so there really isn't going to be any leeway to, troubleshoot or spend as much time as they may have in this past year. So I just wanted to raise that as a broader concern. And I was wondering if you've had discussions about the HRP and what the plan is going forward.
Yeah, I'll cover it and then I'll turn it over to Tanya and then Paul. We have been integrated into the discussions, Wendy, to the Workday project. We're aware of it. We're participating in it. There is impact, obviously, to how you work with Morneau Shepell. The good news is I don't think we think it's huge impact. I think we'll collectively have to monitor, once you all deploy this into your environment to make sure that there's no last minute changes. We've experienced other implementations like this with other clients. I guess if there's any good news in this, and I'll let Paul and Tanya correct me if I'm wrong, the good news is related to at least people's pay. I'm not aware of any, like, outside of the onesie twosies that you have because of timing or defects, where we're having trouble with that component of administration, which is really good. So I think what it will be is that we have to be lockstep for your Workday deployment. And we fully recognize that having to spend less time on benefits administration and more on Workday is a priority. But I'll let Tanya and Paul also opine, because I think it's good to get their perspectives.
Yep, so I'll chime in here and say that we've been working very closely with Paul and his team as well as Workday. So we've had a couple of meetings so far to address both the HRIS process and the payroll process. I think things have been going really well, and we are already discussing risk mitigation with all stakeholders to make sure that we're able to implement both the annual enrollment process or the open enrollment process and continue to focus on Workday at the same time. So Paul, I'm not sure if you want to add anything there.
No, yeah, that pretty much says it. I think our objective for the most part with Workday so far has been trying to make sure that this transition of Morneau Shapelle is as close to present day as far as file feeds and information goes. So there really isn't a whole lot, hopefully, that is going to increase the risk, but risk is still risk. And so trying to minimize it as much as possible.
Any other questions?
Hearing none, you can move on, Kevin.
Thank you all very much for your time on behalf of Morneau Shapelle. Thanks to Siegel for working with us, and obviously to the JLMBC and the benefits department, tremendous partnership. So thank you all.
Okay. I lost my place here, Paula. We're moving to item 6. There's no action need to be taken on this report, correct?
Correct.
Okay. Okay, so we're on item 6, committee report 2106.
Okay, good morning, everyone. This report, we're providing an update, a status update on the health services request for proposal. And then we're also providing some information in response to the question that arose at the prior meeting regarding the RFP rating panel. So first of all, the RFP was released on February 11th. Responses are due March 31st. We've received a very robust set of ongoing questions from prospective bidders. So we are expecting a strong response of actual proposals once we get to the RFP due date. With respect to the review panel, so following the questions that David posed at the last meeting, we consulted with the city attorney's office. Their guidance is that while members of the JLMBC may not also participate on a procurement review panel, other alternatives exist. And we've outlined for the JLMBC a model where both management and labor could designate outside raters to serve on the committee. You'll see in the report that we've set a number of requirements for the outside raters, and I won't go through each one of them individually. What I will say is that the primary intention here is that, first of all of the raters on the panel will have the same expectations and will basically be performing the same work. And that's just to make sure that that the process is being conducted in a uniform manner. And then also our focus here really is just on being able to ensure that the process is successful, which means that we just want to make sure that all the rating panel team members are working together, they're on the same timelines, so that we can execute all of the deliverables that need to be produced when they need to be produced. As we had indicated to you in our January report, we've designed a process that is different than the ones that we have done before. We are making extra efforts, considerable efforts, to be abundantly transparent and abundantly accountable for the work and the information and all the outputs that will be that will come out of the review committee. So with all that said, we're actually very excited about the project. We not only have the rating panel members, but also two very capable consulting firms that will be part of what we envision to be a collaborative team-based process to process all of this considerable information and then bring back to the JLMBC so that you have everything that you need in order to put together your recommendation. So in terms of the on the assumption that the JLMBC wants to go forward with having rating panel designees from both labor and management, we would ask that both the labor and management constituencies identify their raters and provide them to us by the end of this week, March 26th. The labor and management teams should work through their respective chair and vice chair representatives on the JLMBC to communicate that information to staff. And then once that's done, then we will immediately reach out to those individuals to onboard them into the process early next week, as really we intend to hit the ground running and start the review process April 1st. And then last, the report is also just informing you that we are asking you to reserve a series of dates in May and June for meetings. We do not expect that we'll be meeting every week, but we want to reserve those dates to provide us some level of flexibility in scheduling. And that's just because all of the process elements that are going to be part of this, and that includes, you know, time for us to present our findings. If the JLMBC wants to schedule vendor interviews, we need to work those in. You'll recall also the RFP does provide an opportunity for best and final offers. We need to put that in there. And then of course there needs to be final actions, which all needs to be done in time for us to write a report to council and get it to council in June for their adoption of the 2022 LA Well program. So with that, I'm happy to take any questions.
This is David. I have no questions, but thank you. I've read it. It's acceptable to me. We'll submit a name. Thank you.
Okay. So if there's nothing further from any of the other committee members, then this report is just a note and file, so no action is required.
Okay. There ain't no other comments or questions? And Stephen, thank you for your presentation. We'll move on to item number 7, Committee Report 2107.
Hi, this is Paul McCuskey again on this report. The committee may or may not know that the domestic partnership program that LA Well uses is a pretty old program as far as it goes, or opportunity as it goes. And we get authorization to do that in a couple different ways. So there's each MOU pretty much has an identification that employees that are looking to file a domestic partnership can file with us, or they can also use their Secretary of State signature certificate. And there's a couple different reasons why an employee might want to file a domestic partnership. So LOL benefits is definitely one of them, but that's not the only reason. There's a number of other reasons why an employee might want to file their domestic partnership with us, to take advantage of other benefits that are offered to them, including leave. So our domestic partnership program has been built in a way as a catch-all to have a number of options outside of just getting LOL benefits. And also this program is quite old. It started in 1994. Back in 1994, there was a definite distinction or difference between state law and the ordinance and authority that the city had provided. And at that time, and leading up to recently, there has been a little bit of discrimination on the state side, where the state required or limited who could file a domestic partnership, whereas the city had not. Now, as of January of last year, there is no more identified discrimination as previous years on the state side. So an employee can file with the same requirements on the city side as the state side in establishing the domestic partnership. So what we're trying to do through this action is bring our domestic partnership program more in line with what the state law requires, since state law no longer has the age and gender limitations that it previously had for the past 2 decades. And so this report is really just announcing loud and clear throughout the rest of the city, because our domestic partnership file could be used for multiple reasons, even for people that are not eligible for LOL benefits, but announcing really what these changes are and what it means to an employee. So we're identifying some changes in our actual registration process, which is probably easiest to understand by looking at the attachment itself and seeing what is being asked of an employee when they file with us. they're going to be adhering or attesting to the same exact questions that are being asked by the state, so that matches. And then through this process, they'd also be getting a receipt from us, or a certificate kind of that identifies when their domestic partnership started. And that process is something that we haven't had before. It's really important for employees to have something that can take with them so that they can take their filing and show it to their employer if they needed to take time off for the domestic partner, show it to lacers or fire and police pensions to prove that they've had a domestic partner for a period of time leading up into their retirement, as well as any other instance that they need to be able to show that proof of their relationship. And so this, we're making this a large conversation to also educate HR sections and also organizations of this change, so they can kind of get to know what to look like and know to let their employees know, or their members know, that there is a certificate process that we're now going to be able to provide to employees. We're planning to launch this next month. We still have a couple tweaks to figure out as far as getting this process fine-tuned before we announce it, but we're going to have a big communication campaign over this administrative change of the domestic partnership process. And I'm happy to answer any questions about this report or about the domestic partnership process that employees go through with us.
Quick question, Paul. So for domestic partnership to enrollment, they don't have to wait to open enrollment. They can do that now. Or is this...
Correct. So in the concept of domestic partnership, they could do it whenever they have a domestic partnership start. So our previous rules before state law came up to go through there was a waiting period where someone had to be a domestic partner with somebody else for a period of time before they met the eligibility. State law no longer requires that. We're not going to require that moving forward. So they could, if they started their domestic partnership now, they could fill out this paperwork and establish it now. They did not have to wait to open enrollment. That is correct.
Thank you.
One thing that I didn't note, but is noted in the report, because our old rules did have that waiting period, we are going to have an overlapping window for a period of 1 year to allow anybody who is still under the waiting period rules to still be able to have that domestic partnership established when they meet that waiting period. But anybody who didn't have to wait for the waiting period, they can, once we launch this program and launch this change, they can do that at any time.
Wait, can you clarify that, Paul? Because that was my question. So somebody who did submit this and had the waiting period, they still have to abide by that waiting period?
Well, it's an attestation or an affidavit, so it's up to whether or not, depending on their scenario, if they had a waiting period or not. But probably the easiest way to put it, our old rules required a 12-month waiting period. So if you started your relationship with somebody, you could not establish a domestic partnership under our affidavit until you've been with that person for 12 months. You could go to the state if you didn't have those requirements or limitations with the state that were age and gender, and file with them with no waiting period at all. The state erased that or changed their requirements to not have the gender or age limitations as of January of last year. So all of last year, they could file with the state automatically, not have any difference. But if they had wanted to only file with us, we would have required them to wait 12 months. So the best case scenario is through open enrollment, maybe you had somebody who wanted to file with us and they started their relationship in September, but open enrollment was in October. So we would have told you at that point, oh, you don't meet the 12-month requirement, you have to wait. So now, because we're going to overlap these two different rules, somebody can either, if they wanted to file this paperwork, if they identified that they met the rules of the new program, they could file right away. But if they still wanted to establish that waiting period, or because we told them they had a waiting period, they can wait until September. They're still going to be able to file the old form when they meet that 12-month period on the old form.
Understood. Thank you.
Any other questions, comments from the committee?
If I could, real quick. So if you're going to get married, let's say, it's considered a qualifying event, right? So when you get married, you can add your spouse now to your benefit, your health benefit, right? So for a domestic partnership, what I'm understanding from looking at the report and from the discussion is that kind of going forward, it will also be more like a qualifying event like a marriage.
Correct.
Right?
In the old form, it was still a qualifying event too, but it was only when you met that 12-month window.
12 months.
But now but moving forward, the 12-month window would not apply anymore as long as you're meeting the requirements of the new form and signing that affidavit. So as soon as you tell us that you have the relationship, is the qualifying event.
I think that's great. I think it's a long time. I think this, I think that is exactly the way it should be. It should be treated like marriage and be characterized as a qualifying event without a 12-month waiting period before you get a person the coverage. So I think this is exactly the right thing. So.
Thank you, Neil. And anyone else? Thanks, Paul. We'll go to report number 8. Update, level program update.
Thanks, Dave. So that's me, Jenny, with the Live Well program. So this is our monthly wellness projects and activities report covering January and February 2021. So in January and February, we continued with wellness programming delivered virtually over Zoom by offering live exercise classes during the daytime and in the evening. So we continued with Pilates, yoga, kickboxing, Zumba, Tai Chi, circuit training from boot camp. We continue to also host follow along cooking demonstrations on Wednesday evenings and introduced a new afternoon 15-minute stretch and meditation break for employees. Those afternoon breaks were pretty well attended, so we'll be continuing those classes into the future months. In total, we had over 1,350 engagements in January and over 1,500 engagements in February with the Zoom classes. So we're continuing to deliver that programming virtually, and we're glad to see that the level of engagement remains steady in this new virtual environment. We also continue to hold live webinars through the Wellbeing at Work and Home Science of Webinar series. So in January and February, we held a Science of Weight Loss and a Science of COVID-19 Vaccine webinar, and both were well attended. In total, we had 850 participants who attended both webinars and subsequently had about 1,000 viewings of the webinars on the Live Well website. So we continue to work with both Anthem and Kaiser to develop additional, I'm sorry, I'm blocking myself, additional webinar topics for later in the year. And then finally, we also conducted some special campaigns over the last 2 months. So in January, we conducted Live Well's first citywide virtual team challenge on the livewell.la wellness platform and mobile app. Employees were encouraged to reach out to their coworkers and connect and form a team and complete 1 million steps over 4 weeks to earn 300 points. The top 5 teams also won additional prizes, and every participant earned a participation medal and a running belt. So it was a lot of fun. Had a lot of city employees very active on posting to Live Well social media during the campaign. So we'll report back at the next meeting on participation results for that steps challenge. And then secondly, in January, we also partnered with the mayor's office to develop and release an employee COVID-19 vaccine survey so that we could learn more about employees' opinions about the vaccine, plans on getting the vaccine, and any potential barriers to getting that vaccine. So we are still collecting some of the responses, so we'll report back on the results after we've gathered enough responses there. And then finally, in February, we also launched a brand new supervisor resources webpage on the Live Well site. So the website does provide supervisors and managers with information on the many tools and resources offered through Live Well to continue to create and encourage and support workforce wellness year-round. The resources do include handouts, tips, information on the EFAP program on the website in one convenient location for supervisors and managers to review and take a look at. So I highly encourage you to check that out if you have some times right up on the Live Well website. And then lastly, just a quick update on the flu vaccine campaign that we ran in the end of 2020. So we're still waiting on some additional data from Kaiser and Anthem regarding flu vaccination rates for the entire civilian population covered under the LA Well program. So we'll be reporting on those results at the next meeting in May. So that concludes my update. Any questions on this one?
Did the SEIU team win the challenge?
I don't know. Well, you'll have to wait and find out, Dave.
All right.
I have a real question.
EAA won. I think EAA was top.
On the Those 15-minute stretches. I think that's a really cool idea. And I'm working on a new communication mechanism for my members that's pretty immediate through text message. Is that a link that can be sent out, or do they got to pre-register for something like that? And is that ongoing? I can't scroll back on there.
It is ongoing, Marlene, and they do have to pre-register on the Live Well website. So if you just go to the Live Well website and connect to the calendar, actually, they can actually sign up right there on the website. So you can put the link actually to the website, and it'll take you there for the registration page.
Thank you.
Sure.
Hey, Jenny.
Yes, Neil.
So I'm one of the 6 subscribers to the Live Well YouTube channel that we have. There is the one video that's on there right now for enrollment purposes, but it would be great if we can get some more of the various webinars and things like that are done onto the YouTube channel, so that if you can't listen in when it happens, you can just go there to the YouTube channel and listen whenever it's convenient for you for active members.
Yeah, let me look into that. The webinars are posted on the website, but I'll check out the YouTube channel. So let me look into that further. Thanks for pointing that out.
No problem. Yeah, our Lacers Well, we have about 30 videos on there, and we're 800 subscribers now, so we're getting real popular. So I'd like the same for the Live Well YouTube channel.
Got it.
Okay, any other comments, questions for Jenny, others? If not, thank you, Jenny. We'll move on to item number 9, activities report.
Good morning, JLMBC members. This is Chung Tran, and I will be presenting the projects and activities report. For the months of January and February, we have just 1 informational item and 3 project updates on this report. First up, the informational item. Regarding the LAWA COVID-19 testing that was reported at January's JLMBC meeting, staff has since then participated in discussions with SEIU, Kaiser, Anthem, and Clarity Lab regarding the establishment of the billing process and operational requirements for the on-site testing services. On to the project's updates. The first item we have is regarding the ACA. In January, we were able to mail out 46,000 Form 1095 Cs by the January 31st deadlines. The 1095B forms were mailed out to members by Kaiser and Anthem. Only a minimal number of calls were received regarding the 1095 forms. Staff and the consultant Ernst & Young have been working to transmit the final data to both the states and to the IRS. On to page 2 is an update on the Consolidated Appropriations Act of 2021, or 2021 CAA for short. The CAA was passed by Congress and signed into law in December 2020. The CAA contains guidance for certain COVID-19 relief that relates to the city's health care and dependent care flexible spending accounts. The city has adopted 3 provisions that became effective March 1st of 2021. The first provision is an extension of the grace period for incurred expenses. In 2020, the grace period for the 2020 benefit year was extended to March 15th of 2021. Under the CAA, the grace period has been extended for the 2020 benefit year through December 31st, 2021. For the 2021 benefit year, the grace period was also extended a full 12 months and will be in effect through December 31st of 2022. The second relief provision is an increase on the age limit for the dependent care flexible spending account. Under the previous limit, the dependent care age was limited to age 13, but with this new provision, that age limit has been increased to 14 for allowable expenses. The third relief provision allows for changes to both healthcare and dependent care flexible spending accounts. Members who do not have an existing flexible spending account can enroll in one. And for members who already have an existing flexible spending account, they can increase or decrease their election amounts. And finally, we come to the staffing summary. In January, EBD made some internal staffing changes due to anticipated losses from the SIP and non-SIP retirements, and also due to the reorganization of the benefits accounting staff moving from the Administrative Services Division over to the Employee Benefits Division. Joining EBD are Kevin Hirosa from the Commute Office. And for the benefits accounting teams, we have Andrew Pollard, Isela Gerardo, and Ending Vidako, joining us as part of the benefits accounting team. We also lost two members recently. Judy Murto and Helen Georgeson had just retired about a week ago. And in the next 2 months, we are also going to be losing Maria Lopez and Susan Valancourt. And with that, is there any questions I may answer?
I have a question on the LAWA on-site testing. Are there any updates? I think the last conversation we had, the vendors had a report back to us on some process issues. Is that resolved, or are we moving forward?
So I can jump in. So there's one issue that is still outstanding with the LAWA vendor. And it has to do with the requirement, their requirement that there be some type of physician authorization that would be required for the testing. Both Kaiser and Anthem have indicated that that is not required of them in order to provide reimbursement. So the outstanding question to the vendor is basically, can they work with that? And we are still waiting for them to get back to us on that.
Do we anticipate a date when they will? Is that happen like soon?
You know, I've reached out a couple of times over the last few weeks. In fact, just over the weekend. So if I don't hear back in probably the next day or two, then I'll probably work through LAWA to see if we can we can arrange to have some further conversation with them.
Okay, thank you. Any other questions, comments from the committee regarding the report? If not, thank you, sir. And we can move to the concluding items. Item 10, requests for future agenda items. Are there any? Hearing none, no additionals. Why don't we move to next meeting date, May 6th? Are we confirming that to be a date, or do we need to, are we surveying if that's a good date, or that is the date? I know we changed last time, so.
Right, so we will check on availability as we always do, and as referenced in the earlier report on the health RFP, that what we're basically saying is plan to be available for all of the Thursdays in May and June, but we might need to make some adjustments to that just based on where we're at in the review process. If we're able to put together the first set of deliverables for May 6th, then that's what we'll do. If we need another week, then we'll let you know.
Okay. Does Paul Beasley want to make a motion to adjourn?
Paul Beasley does, makes a motion to adjourn.
Yes, you can go ahead and second. Somebody, yes.
Gary will second.
Absolutely. Thank you all. Appreciate it. Be safe and we'll talk soon.
Thanks, everyone.
Thank you.
Thank you, everyone.